Thank you all so much. And we'll move to our next presenter. So we have, yes, so Shokoufeh Modanloo, a postdoctoral research fellow at the University of Ottawa, who's presenting today. The title of the presentation is Experiences Translating Knowledge with Algonquin of, I'm so sorry, Pikwàkanagàn. I'm sorry, I am probably not pronouncing that correctly. First Nation for culturally safe cancer survivorship care. And I will pass the mic over to you. You should be a co-presenter now and able to share your slides. Please let us know if you have any issue.
Thank you, Kim. That was a great introduction. Hopefully you can hear me well. Okay, so I will try to share my screen. And okay. Hello, everyone. I would like to thank you all for being here today for this presentation. My name is Shokoufeh Modanloo, and I'm a postdoctoral research fellow in the School of Nursing at the University of Ottawa. The title of this presentation, as Kim mentioned, is Co-creating Culturally Safe Cancer Survivorship Care with Indigenous Peoples. And I am presenting on behalf of Dr. Wendy Gifford and her community partner, Miss Peggy Dick, who both were unable to be here today. Dr. Gifford is a professor in the School of Nursing, and she holds the Lawyer De Silva Research Chair in Community and Public Health Nursing. And she's also the co-director of Center for Research on Health and Nursing at the Faculty of Health Sciences, University of Ottawa. Before I begin, I would like to acknowledge the land that University of Ottawa is situated on, where is the traditional, unceded, and unsurrendered territory of Algonquin and Anishinaabe peoples, whose presence here reaches back to time immemorial. I recognize the legacy of colonization and dispossession of land that has actively sought to erase traditional ways of knowing and being in the world. In the next 30 minutes or so, I will go over some brief information about the background on Indigenous peoples and cancer care. Then I will present the methods and results of 2 studies within a larger program of research aimed to promote health equity for Indigenous population. So for the background, we all know Indigenous people experience higher cancer burden than non-Indigenous counterparts. In general, they reported higher rates and lower 5-year survival rates. This could be due to many reasons, such as underlying causes, such as low rates of screening and late-stage diagnosis. These unique cancer burdens faced by Indigenous people have largely been attributed to the impacts of colonization and structural racism. Historical trauma has profoundly impacted Indigenous people's trust and engagement in Western healthcare system. Most research studies working on culturally safe care for Indigenous people have been conducted from Western perspective and Western epistemology, and have not incorporated Indigenous knowledge and values into cancer survivorship care. So Dr. Gifford's program of research aimed to promote health equity with disadvantaged and marginalized group, with particular focus on working with First Nation, Métis, and Inuit people in Ontario. In line with this goal, 2 studies were conducted to explore the meaning of culturally safe care in cancer survivorship journey for Inuit and First Nation peoples. Study one was conducted with partnership of Algonquins of Pikwàkanagàn First Nation, which is a rural First Nation community located in Ontario with approximately 500 people living on reserve. And study two was a partnership from the University of Ottawa, Pikwàkanagàn Inuit women of Canada, and Tungasawinga Inuit. We use qualitative research design grounded in experiences and perspective of participants and a strong community engagement and emphasis on cultural values and mutually respectful relationship. Our approach was grounded in Chapter 9 of the Canadian Tri-Council Policy Statement on research involving First Nation, Inuit, and Métis peoples. We collected data through group discussion and individual interviews with cancer survivors, family, and healthcare providers. We also used journey mapping to capture people's story. Early discussion with community research partners showed us that journey mapping is a culturally relevant strategy to understand the experience of people accessing cancer survivorship support. Actually, journey mapping is a process in which we can trace a patient transition through the healthcare system. Then we all of our data audio recorded, transcribed, and analyzed in partnership with our community partners. And this session were also video recorded. For producing a professional documentary video, our collaborator, Ms. Danielle Rolfe, created a documentary film about this study as a method of sharing these stories. I am now going to discuss the findings of two studies. In a study with Algonquins of Pikwàkanagàn First Nation, there were 5 broad themes addressing culturally safe care, and these include broad definition of family, care for caregivers, trauma-informed bereavement, culture as healing, and story as cultural teaching. And we will now go through each of them. Broad definition of family shows that family is a complex network of people and relations, and this conceptualization does not fit with Western settlers' idea of nuclear family. For example, one of our participants said, "I don't think they understand our family orientation, where we are just not our immediate family. We have extended families and people that we treat just like brothers and sisters." Another theme that emerged in the discussion with participants was that the concept of care also include care for caregivers too. And this really built on the idea that family is part of a team and the client and caregivers become one in Indigenous culture. So as one of the family member in our study mentioned, "My dad spoke of old days when they looked after their family members, and that's really evolved over the past century. So on the traditional side, it's history repeating itself." Another theme was the concept of trauma-informed bereavement. And this includes the idea that cancer is a form of trauma, and that can trigger vicarious trauma in community members. And different situations and people can trigger different form of trauma in a community. Participants spoke very explicitly about this by stating, "We need to start looking at this trauma. We are picking up a lot of these feelings because we've had so many deaths in the community." Or another family member mentioned, "He was a Native person and he was discriminated quite a bit. So that kind of, makes you tougher too. He can remember how it used to be. like on this reserve, and how they were treated and how he had to go to school. He'd been in trouble all the time. He couldn't stand the nuns, right? Because the nuns ran it, and the nuns were mean. To understand the concept of culturally safe care, the key here is to emphasize the culture, values, and beliefs. Those are the form of healing and have healing effect for the community. Ceremonies and cultural practices such as smudging, laying down tobacco, and drumming are considered treatment. Here we can see a quote from a participant saying, "Our way of doing things is totally different. The way our ancestors did everything. Sometimes that's the biggest part, getting that positive energy to stay positive." There were people shared different stories about different cultural practices as a form of transition through their cancer journey. These stories are foundation to cultural teaching. And as stated by another client, sharing the story probably what's most important. And so that's what we can learn from each other. Here are some screenshots of the documentary movie produced from the stories of cancer care journey shared with us by community. You can find this 20 minutes film accessible by the link in this slide. In our second study with Inuit population, three major themes emerged from the findings from group discussion and interviews, which include access to traditional way of life, communication, and family involvement. We will look at each more closely. The access to traditional way of life is very important to our Indigenous peoples. Participants stress the cultural importance of country food for overall well-being and healing. In addition, the urban setting was described as challenging for Inuit patients and family to participate in traditional activities, such as crafting or spending time out on the land. One of the healthcare providers mentioned in our study, "I always use a land-based approach. I try to get out and about and away from the hospital setting as much as possible. I feel that's where the most trusting relationships are developed. Going out berry picking, activity like that is important to them. Going goose hunting, going fishing, going hunting and stuff like that. Those are very important, and that can be tied again to stress relief and being connected back to the land." And what I have found in the past very healing is doing art-based activities like beading, for example, and also swing. Inuit communication was discussed as extending beyond simply words, and that are spoken to include different forms that should not be understood by healthcare provider working. That should be understood by healthcare providers working with this population. Clear communication between patient and their healthcare providers is an essential part of healthcare cultural safety. Clear communication leads to services that are free of racism and discrimination and helps build trust and support the cancer journey. The first form of communication, as obviously, is language, the words we use. The key point here is that our participants said is that it is very challenging to translate Inuit language to English or vice versa. The help of knowledgeable translators sometimes is required. The second piece is nonverbal communication. That does involve, for example, eye contact, physical proximity, but also it is more than that. It is about communicating respect through our body and through our action. Here in this slide, you can see a picture of my journey booklet that produced by Post-Doctoral Women of Canada and Canadian Cancer Association that explains cancer terminology and journey in a culturally safe way to communicate equality with community. The next sub-theme emerged in the communication area was health system, care processes, and delivery, which means it is not just the individuals, it is our whole system. The way it operates, that doesn't communicate cultural safety. And participants described how colonial practices reinforce paternalistic and non-inclusive approaches toward health and healthcare. For example, one of our participants said, when the Europeans came up north, they were in control, and up to today, they're still in control. They just say, yeah. Inuit people have to say just, yeah, okay. Like no input. If you try to say anything, nobody is listening to that person. I don't want that. In the end, they become bitter because they're just listening to the nurses and doctors, bitter and bitter and bitter. So being down here in urban setting longer and away from their family longer, they tend to go downhill faster, and their mental health illnesses goes down faster as well. And our third major theme was family involvement. Same as first study, participants described here how family relationships are an essential aspect of Inuit culture and discussed how Inuit understanding of family is different than non-Inuit. For example, I once said they already have family support or community support because that's how we were brought up, to support each other through hardship or death in the family or whatever. It is the community thing. It is not individuals like it is down there. Like everyone's alone down here. Up north, everyone's together. What we can see from this quote is family not necessarily mean that blood relatives. It is the whole community. And when one person is affected by cancer, it means the whole community is affected. As a discussion, we can summarize everything that as our healthcare system prioritizes cancer treatment over holistic care, meaning in our biomedical focus, we focus on treating the cancer and forget the person and what culturally safety means. Where when we don't engage in conversation about politics and funding and decolonization, we in a way perpetuating and participating in a system that isn't culturally safe and discard that person as an individual. We need to respond to the calls to action of the Truth and Reconciliation Commission that involves realignment of the healthcare system, what it means when we say family, what it means when we say care and culture to Indigenous health. That needs having that difficult conversation and a strong advocacy to give care. Lack of direction at institutional and government levels contributes to complex barriers that prevent culturally safe cancer care for Inuit people. As conclusion, what our studies have created is a new way of thinking about culturally safe in cancer survivorship care. Stories created a legacy for individual and community healing. We need to conduct research from Indigenous epistemology, from Indigenous values and principles. We need to generate knowledge that is truly safe, relevant, and appropriate to this community. I also would like to acknowledge our critical partners on this project and funding we received from Canadian Institute of Health Research and Ontario Ministry of Health and Long-Term Care. Ms. Sepura Enurag and Savannah Ashton from Paktutit Inuit Women organization, and Ms. Danielle Rolfe that created the documentary video. Ms. Maggie Benoit and Peggy Dick from Algonquins of Pikwàkanagàn and our Ottawa research group. Here is the list of our references. And if there is any questions, I would take, and I would also like to thank everyone who is here today listening to this presentation. Thank you.
Thank you so much, Shokoufeh. That was lovely. And I welcome and open the floor to anyone that has any questions about this work. Please feel free to unmute yourself and show your camera if you're comfortable or able. And if that doesn't work, you can always enter into the chat. Katrina says, thank you. I know Wendy had to send her regrets, and this was well presented.
Thank you, Katrina.
And Rachel asks if the presentations will be available to us. And yes, Rachel, everything is being recorded today, and we will share right as soon as it is available online. So I have a question while we're waiting for questions, saying that we have 2 minutes left, and I want to make sure we utilize your time. So do you have any advice for those that are wanting to do research in a similar way, research with Indigenous communities and research that has that community lens, community action approach? What advice would you have for folks that are interested in exploring this?
Is that a question for me? Yeah, okay.
Yes, absolutely. Yeah.
Amazing. So, well, I should have added that because the presentation and this program of research is for Dr. Gifford. So, but I myself, I'm from Middle East, and I do myself community-based participatory research with refugee community in Ottawa. And one thing that stood out for me the most, and was the reason I was successful in establishing the trusting relationship with community, to bring them on as a partner alongside with the researcher, was me being part of the community, was me being the face of the research group. So it's all about nothing about us without us. If we want to do the research with the community, we have to make sure our academia is more representative of the people of the community. So if we don't get that done as soon as possible, the community research based research, sometimes it sounds like a distance. It sounds like people are coming, doing the research, and all forget about it. So hopefully that helps.
Absolutely, absolutely. And thank you. And we do have one more question in the chat for Ambreen. And thanks for the great presentation as well. What are some ways you think to possibly make the healthcare system more responsive and culturally safe to Indigenous people's needs?
That's a great question, and Amber. I would say it's a long way. It's a long way to get there, but to be positive and start one day at a time, we can start with raising awareness, that truth and reconciliation, what happened in the history, what the system is coming from, and how is established, and how is not fair, and how the inequity established in the history. Bring that knowledge forward and telling the people the truth, that actually helps people to raise that awareness of what happened in the history. That's the first step. I mean, I am also a nurse and a teacher. I teach in the college to other nurses. And one thing that I put, it's my mission in my classroom is, if I get the nurses to be politically informed and socially informed of what is happening in here in Canada, and go out there in the hospital at the bedside, and when they see an Indigenous patient or any marginalized community members, they have the knowledge how to do not harm. If you do not want to do it like a good thing, at least does not cause more harm. So if we can get that our nurses knowledgeable about social and political context, I think that's the first step to start from there, and then we can build from there.
Thank you. And Jessie, I recognize that you've raised your hand, but we are going over. Would you like to ask very briefly, or would you like to carry the conversation on through email with Shokoufeh?
I had one quick comment. I'm actually taking a master's right now in nursing, and it's very interesting because this week we've been doing some education around what cultural safety education happens. And there's a thought that maybe the shift should be around looking at what white privilege means and using words like racism, and really shifting that to being more blunt, if you will. And, reviewing what whiteness means and how we come to know what we think is culturally safe. So that was just a closing comment that I thought about.
Thank you. Thank you for sharing. We'd like to thank you so much for presenting on behalf of Wendy as well. And we have both Shokoufeh and Wendy's information available in the FeedLoop platform. And if you need a facilitation connection, feel free to email me at research@interiorhealth.ca. So thank you so much. And we'll move on to the next.